I think people want me to ask questions on all of these, but we're just going to touch on them, and hopefully people will go out and download the reports, and you can give us the URL towards the end of the show. But so let's touch on a few of these. What kind of things are we looking at in a recovery phase from COVID? What things were you finding?
Yeah, I mean, for most health systems, what COVID revealed was sort of a fundamental disconnect or a fundamental error even in the way that healthcare is paid for. It revealed that without elective surgeries, we're all dead in the water, right? And people in healthcare have known this for a long time, right? That we have the incentives that are aligned around certain kinds of surgical episodes of care, and that can be more aligned around sort of health more broadly. So in the immediate recovery phase, health systems across the country were saying, okay, how do we get elective surgeries back up and running? How do we make sure that we get people tests? How do we make sure we ship the equipment that we need home to them? We actually I've got it here. I know that some people aren't on video, but we have these kits that we're sending to patients before surgery to make sure that they have sanitizer and gloves and masks and those kinds of things. We stood up over a weekend a home monitoring program with a partner that we had already been working with called Twistle that we'd actually been using for surgeries. So we had to automate scheduling for pieces of this. So a lot of technology just around how do we get people back in safely had to be deployed like that. And I think that one of the things that we feel fortunate to have had is a team that was really focused on digital before COVID hit, because we weren't going around searching for partners to help stand up a home monitoring program. We knew some folks in our portfolio that we were ready to work with, that we had worked with before, that we could partner with to move really quickly. So there was a lot of tech, a lot of people stood up quickly. I know that we scaled Zoom to tens of thousands of providers, or was it about 10,000 providers really quickly. So a lot of that work had to be done just sort of immediately. I think now we're starting to see in sort of the post-emergency lull, not that it's still not an emergency in many ways, some people saying, oh, this workflow isn't great for me. Or, oh, this part of the process is something I hadn't gotten into yet. So we're sort of through some of the emergency response recovery piece, but we still got a long way to go for the real recovery.